Hi, welcome to the Nurses Academy. Today we will discuss some of the questions that is useful for NORCET and RRB and JIPMER also. Start discussion. First question. Mr. Rani, 17 years old client, is admitted with the diagnosis of mild chronic heart failure. The nurse expects to hear when listening to a client's lungs indicative of chronic heart failure would be. So here question, she is suffering with the chronic heart failure. So what sounds we expected to listen in chronic heart failure would be A. stridor, B. crackles, C. wheezes, D. frictions. So the answer is B. crackle sounds. Why there is a crackle sounds? If the patient is suffering with left-sided heart failure causes fluid accumulation in the capillary network of the lung. The fluid eventually enters alveolar spaces and causes crackle sounds at the end of the inspiration. So here what will happen? Left side heart failure causes a fluid accumulation in the capillary network of the lungs. So it will accumulation of the fluid in the lungs. In the lungs alveolar tissues also it will be accumulated, then causes the crackle sounds. Then we will discuss about the second question. Patrick, who is hospitalized following a myocardial infarction, asked the nurse why he is taking morphine. The nurse explains that morphine. So why he is morphine is a patient Patrick is asking here nurse why he is using for morphine. Morphine sulfate will frequently used for the pain reduction and also cardiogenic shock relief. So here A is decrease anxiety and restlessness. B is prevent shock and relieve pain. D is dilates coronary blood vessels. D is helps in prevent fibrillation of the heart. B is our answer. So here prevent shock and relieve pain. Morphine is a central nervous system depressant used to relieve the pain associated with myocardial infarction. It is also decreases the apprehension and prevent cardiogenic shock. So here and morphine mainly used, most commonly used in pain management. Morphine provides major relief to patients afflicted with pain. Patient who is suffering with cardiac related pain, and also it will relieve the cardiogenic shocks also. So the answer is prevent shocks, cardiogenic shocks and relieve pain is main role in morphine sulfate. Next, third question. Which of the following should the nurse teach the client about signs of Digitalis toxicity? So Digitalis we will give in a patient, heart patient. What is main toxicity? If it is a pain toxicity is there in patient, Digitalis toxicity is there in patients, there is an increased therapeutic level of dose, then we will call Digitalis toxicity. Okay. A is increased appetite, B is elevated blood pressure, C skin rash over the chest and back, D is visual disturbances such as seeing yellow spots. Okay, so the answer is main Digitalis toxicity we will see visual disturbance such as seeing yellow spots. Patient will see yellow spots. So here seeing yellow spots and color vision are common symptoms of Digitalis toxicity. Of note, visual changes especially involving color such as seeing yellow hues are better known as specific Digitalis toxicity. So other visual problems including if a patient is having photophobia and also diminished visual acuity is also Digitalis toxicity. Mainly here yellow spots the patient will see, and also photophobia also present in patient with the Digitalis toxicity, and also visual acuity also diminished, unable to see the patient other objectives also side effects of the Digitalis toxicity. Next we will discuss fourth question. The nurse Trisha teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help. Why morning furosemide patient need to take? Why only morning they will give oral? A. Retard rapid drug reabsorption. B. Excrete excessive fluid accumulated at night time and prevents sleep disturbances during night. C. And D is prevention of electrolyte imbalances. Here our answer is excrete excessive fluids accumulation. No, prevent sleep disturbances during night time. How This one, furosemide will cause disturbance, diuretic. This is one of the diuretic, furosemide. And when diuretics are taken into the morning, the client will avoid frequently during daytime and will not need to avoid frequently at night time. Normally, when an individual receives furosemide either orally or intravenously, it increases the sodium excretion in the urine. In a patient with extracellular volume expansion who has never had exposure to the furosemide, the first dose of the drug causes significant sodium excretion and diuresis with the first 3 to 6 hours. So, if you will give morning furosemide, it will causes frequent urination, and night time no need to go for frequent urination. It won't cause sleep disturbances during night. C is our answer. Next question. What would be the primary goal of the therapy for a client with pulmonary edema, heart failure? A. Enhance comfort. B. Increase cardiac output. C. Improves respiratory status. D. Respiratory status. D. Peripheral edema decreases. So the main role is increase cardiac output. The primary goal of therapy for client with pulmonary edema or heart failure is increase cardiac output. Pulmonary edema is an acute medical emergency, so medical emergency required immediate interventions. Preload reduction decreases pulmonary capillary hydrostatic pressure and reduces fluid transudation into the pulmonary interstitium and alveoli. Here, increasing of cardiac output, there is a improves in renal perfusion and also diuresis. The patient fluid overload will be released. So main role of primary goal of therapy pulmonary edema, if patient is having means, we need to improve cardiac output. Automatically kidney functioning also will improve, and the overload fluid will also excrete through the kidney. Next question. A female client is taking laxatives. The nurse Betty informs the client that following may be experienced as a side effects of this medication. When female patient is taking laxatives, what is the main this is laxative, not Lasix. Okay. What is the main side effect of this laxative? A. GI bleeding. B. Peptic ulcer disease. C. Abdominal cramps. D. Partial bowel obstructions. C. Abdominal cramps. If any patient is taking any laxatives, it will cause abdominal cramps. See this and nausea also it will cause. And most adults they will take if patient is having any abdominal discomfort and any abdominal discomfort, then they will take this drug. And if they will take this laxative, the patient may have got discomfort in abdomen and cramps, nausea also patient will get. This is side effect of the laxative. Dr. Morpheus orders a continuous intravenous nitroglycerin infusion for a client with suffering from myocardial infarction. Which of the following is most essential nursing action? A. Monitor urine output frequently. B. Monitor blood pressure every 4 hours. C. Obtaining serum potassium levels daily. D. Obtaining infusion pump for the medication. So here nitroglycerins are the intravenous nitroglycerins are giving. So we need to obtain infusion pump for medication. So through infusion pump only we need to give nitroglycerin infusion. Next question. During the second day of hospitalization of the client after a myocardial infarction, which of the following is an expected outcome? A. Able to perform self-care activities without pain. B. Severe chest pain. C. Can recognize the risk factors of myocardial infarction. D. Can participate in the cardiac rehabilitation walking program. So only able to perform self-care activities without pain. That is our main goal, not other options. During the second day of hospitalization of the client after a myocardial infarction, expected outcome is so able to perform self-care activities without pain is our answer. Already we have discussed. Next, a 68 years old client with diagnosis with a right-sided brain attack and it is admitted in hospital. Caring for a client, for this client, nurse should plan. A. Application of elastic stockings to prevent flaccid by muscles. B. Use hand roll and extend the left upper extremity on a pillow to prevent contraction. Use a bed cradle to prevent dorsiflexion of the feet. D. Do passive range of motion exercises. So here answer is B. Use hand roll to extend the left upper extremity on a pillow to prevent contraction. Because the patient got right-sided brain attack, it will affect left side of the body. So here hand roll and also extend the left upper extremity on a pillow to prevent contractions. So this hand roll will help. Passive exercise also we need to give the patient to prevent the paralysis of the that side. Next question. Nurse Lisa is assigned to care for a client who has returned to the nursing unit after left nephrectomy. The nurse Lisa's highest priority would be, so patient undergone for left nephrectomy. If nephrectomy cases, what you will do as a nurse? His answer is A. Hourly urine output. B. Temperature, able to turn side to side. D. Able to sips clear liquid. Here nephrectomy cases we need to check for hourly urine output. A is our answer. So here we need to maintain the hourly urine output. Along with that, we have to check for any hemorrhage, urine output, and also hematuria, BP, and also this temperature, pulse, everything we need to check. And these patients we need to check IO chart, and blood pressure is more important. So as a nurse we need to maintain the hourly urine output is very important role in nephrectomy cases. Next, number 12 question. A 64 years old man, client with a long history of cardiovascular problem including hypertension, angina, is to be scheduled for cardiac catheterization. During pre-cardiac catheterization teaching, the nurse Cherry should inform the client that primary purpose of the procedure is. Why? What is the primary purpose of the cardiac catheterization? As a nurse, we have to teach the patient. A. What you will teach as a nurse? To determine existence of the CHD, to visualize the disease process in the coronary arteries, and to obtain heart chambers pressure. D. To measure oxygen content of different heart chambers. Here mainly we will do cardiac catheterization. To visualize, B is our answer, to visualize disease process in the coronary arteries where the blocks are present, where the plug will formed, like that we will visualize the disease process of coronary arteries. So that is B is our answer. Next we will discuss about 13th question. During the first several hours of after a cardiac catheterization, it would be most essential for nurse Cherry to A. Evaluate client's bed at 45 elevate. Nurse should elevate the client bed at 45 degrees. Instruct the client to cough and deep breathe every 2 hours and frequently monitor client's apical pulse and blood pressure. D is monitor client's temperature every hour. So after first several hours, the cardiac catheterization, after cardiac catheterization, as a nurse, what we have to do? Here C is our answer. Frequently monitor the client apical pulse and blood pressure is very important. Apical pulse and blood pressure is very important to monitor. Next, Rosa, who has undergone mitral valve replacement, suddenly experiences continuous bleeding from surgical incision during the post-operative period. Which of the following pharmaceutical agent should be nurse Rosa prepared to administer to Kate? So here a sudden experience of the bleeding from surgical incision. As a nurse, what you will do? This is our answer. We have to provide protamine sulfate, B. quinidine sulfate, C. vitamin C, D. coumadin. So here we have to provide the protamine sulfate. So protamine sulfate, why we need to provide? What is the action of the protamine sulfate? Protamine sulfate is used to prevent the continuous bleeding in client who has undergone open heart surgeries. Protamine is a medication to use reverse and neutralize the anticoagulant effect of the heparin. Protamine is a specific antagonist that neutralizes the heparin-induced anticoagulation. Strongly alkaline, and 2/3 of the amino acid compositions is arginine. So here protamine sulfate will give for the heparin. Before doing the surgeries and all, we will do heparin injection we will give to the patient. So heparin is anticoagulant. If more patient is incision site more clot will form means patient may die with the blockage with that clots. So here to prevent the continuous bleeding, what we will do? So that is heparin is anticoagulant. It will causes the continuous bleeding. Then if we'll give protamine sulfate, it will stop the continuous bleeding. So here we need to give protamine sulfate to the patient. Next question. In reducing the risk of endocarditis, good dental care is an important measure. To promote good dental care in clients with endocarditis in teaching plan should include proper use of dash. So, because of lack of oral hygiene, dental hygiene and dental care means dental infections, there is causing of endocarditis with the group A beta streptococcus. So it will causes the cardiac diseases. So in rheumatic heart disease is also caused by the group A beta streptococcus which causes the rheumatic heart disease. It will happen through oral infections only. So it will enter through this bacteria will enter through the oral route only. If we will not perform the oral care or dental care, that will causes the heart diseases. So as a nurse, and that will causes the endocarditis. As a nurse, what you have to tell to the patient? Here the question. So A is dental floss you have to do, and electrical toothbrush we have to do, and manual toothbrush we have to teach the patient, and irrigation device. So dental floss, electrical toothbrushes and irrigation devices all will causes the loss of our dental covering layer. So manual toothbrush we need as a nurse we have to advise the patient manual toothbrushing. Next question. After a long leg cast is removed, the male client should, after removing of a long leg cast, what male client should do? Cleanse the leg by the scrubbing with the brisk motion. Put leg through the full range of motion twice daily. Report any discomfort or stiffness to the physician. Elevate the leg when sitting or long periods of time. So this is our answer. After removing of cast, the male client should, whatever male or female client should elevate the leg in sitting for long time of period. So it will prevent the elevation of leg, prevent the blood increase of the blood circulation, and also prevent the edema in our lower limbs. Next, 17th question. While performing a physical assessment of a male client with a gout of the great toe. Gout means here accumulation of the, here we can see gout means uric acid level will increase. It will be deposited in the extremities or toes like that. So that is called gout of the great toe. Here great toe means our big toe. It will happen, what happened? Uric acid deposit are increased. Nurse Mary should assess for additional toffee deposits on dash. Where she have to see if uric acid will increase to means where she has to see in buttocks, ears, face or abdomen. Where she need to see ears. Our answer is ears. What will happen? Uric acid is low solubility. It tends to be precipitate and form deposit at various sites of where blood flow is least active. So ears, and it is having cartilage. Here the blood circulation is least active. There now all deposits will form and form a toffee. Means like a nodules it will form. Urate form a nodules can found in patient with persistent hyperuricemia. Toffee is occurs joint, ears, fingers, finger ports, tendons and legs also. Okay, toffee means nodules will form in less blood circulation area. Our answer is B is our answer. Next, 18. Nurse Katrina would recognize that the demonstration of crutch walking with a tripod gait was understood when the client places weight on, where here the patient is using one stick. So tripod position, with two legs and one stick. Okay, tripod 3, 2 legs, 1 stick. So quadri means 2 legs using of 2 stick. So where the person will place weight? A, palms of the hands and axillary region. Palms of the hands. B, axillary region. D, feet which are set apart. So the answer is palms of the hand. More pressure, more weight he will put on palms of the hands. Next question. Tina Juice with rheumatic arthritis state. The only time I am without pain is when I lie on the bed perfectly still. During this convulsion stage, the nurse in charge with Mang juice means Tina juice should be encouraged. What as a nurse, what you will be encouraged? Active joint flexion and extension, continued immobility until pain subsides, range of motion exercises with twice daily, flexion exercises 3 times a day. Here Tina Juice with rheumatoid arthritis. She is having rheumatoid arthritis. When she will sleep, that time only the pain is relieving. So during that stage, what a nurse, what you will prescribe to the patient. So active joint flexion and extension, we need to tell the patient to perform active joint flexion and extension. This is our answer. This is our small MCQs today for classes. If you like this video, please share and subscribe. It will be useful for your examination. Thank you.